Just like Alexander Haig, I'm in control here.
Okay, great. All right, good afternoon, everyone. This is the time and place for the properly noticed Silver State Health Insurance Exchange Board meeting. And we're teleconferencing between here in Carson City and down in North Las Vegas at the College of Southern Nevada. For those of us joining by phone, if you would please remember to put your phones on mute, and please do not put us on hold because sometimes that gives us elevator music and then it brings the meeting to a halt. I don't have any other announcements. Do you,
No.
Mr. Hager? Okay. With that, then, let's have the roll call and see if we have a quorum.
Ms. Johnstone indicated she'd be absent. Ms. Lewis.
Savannah Lewis here.
Dr. Klein.
Here.
Ms. Kerr.
Here.
Dr. Ford.
Here.
Director Wilden.
Here.
Commissioner Kipper has indicated he will not be here. Director Mullenkamp has indicated he will not be here. Vice Chair Atkins.
Here.
And Chair Campbell.
Here.
We have a quorum.
Thank you very much. That brings us to public comment. I'll start it here in Carson City. Do we have any public comment? Yes, Ms. Cafaretta.
There it is. Good afternoon. For the record, Elisa Cafaretta, Nevada Advocates for Planned Parenthood Affiliates. You do have this online with your meeting attachments. So I just wanted to, we have been working with you on the network adequacy standards. You have adopted a set of standards that will apply for plans for the plan year 2014, and then the Division of Insurance will have the authority over network standards for plan year 2015. Part of the standard that you did adopt dealt with contracting with essential community providers, and you adopted a portion of the safe harbor protection, which is that to be approved as qualified health plans, insurance companies had to contract with 20% of essential community providers, and if they didn't do that, then they had to contract with 10% of essential community providers in their area with a justification why they didn't contract with 20%. But the rest of the standard in the federal guidance, which I've documented here, is that the recommendation is that networks contract with one of each type of essential community provider. At the federal level, the guidance says in each county. That's probably unrealistic in Nevada, so it's our recommendation that we say that you need to contract with one essential community provider of each type, and there are 5 types that are listed in this memo, per network area if there are those essential community providers and they're willing to contract at reasonable terms. I was thinking on the way down, and I didn't go into this in the memo, because you've already adopted the standards and the companies have already submitted their proposals to you, it's fairly late in the game to be changing the rules. So what I would propose is this. Let us see what the networks look like as they come in. Let's take special notice of this issue of essential community providers, because we are working with the Division of Insurance to make sure the full safe harbor standard is adopted for 2015. I think you and the Division of Insurance could jointly be in a position to encourage providers to work on meeting that standard for 2015, but giving them this transition year while everything is in flux to get there. But I would hope that you would maybe adopt a resolution or make a statement that you would like to see the full safe harbor standard adopted, and that we move in that direction for the 2015 plan year. So that is our request, and I'd be happy to answer any questions.
All right. Thank you very much. We always welcome your comments and your input. Is there anyone else here in Carson City? If you could identify yourself for the record, please.
They said they're getting a little bit of a feedback. If we can mute one more minute.
Oh, there we go. Okay, yeah. Charles Swanson. I'm just a resident of Douglas County, here for myself. My concern is I tend to look at things life cycle from beginning to end. We were promised a long time ago that the health care, there'd be no change. I could keep my doctor. There'd be no cost increase to me. My concern is when I looked at the meeting notes from last time, you're trying to bring in 118,000 new people into the system. You're trying to work with network providers. Yet my concern has to be, are the network providers able to provide the services to me that I've come to expect? So I think the concern is a large demand on a limited resource and how that's going to work into this whole system as you look at network providers. And I just heard that you want 10 or 20% signed up within a region. So my concern is, as a private citizen, will I be able to get medical care in a reasonable amount of time with the number of people we're bringing into the system competing for a very limited resource?
Thank you, Mr. Swanson. And you bring up a point that the whole nation's struggling with, and that is the adequacy of providers that the whole nation has. So it will be a challenge for all of us. Any other comments here in Carson City? How about in North Las Vegas?
No, it does not look like it.
Thank you. How about on the telephone? All right, well, we will close public comment then. Excuse me. After we get done with the approval of the minutes, we've had a request to move a couple of items around on the agenda. So after we get done with approval of the minutes, we will move on to the staff report, item number 8, which is the review of the Gator and grant agreements. So let's move on to agenda item number 3 for approval of the minutes. Are there any amendments, edits, or changes that the board would like to see to those minutes? Hearing none, is there a motion to approve?
Motion to approve.
That was Dr. Klein. This is Dr. Ford. I second.
All right. Thank you very much. All in favor of the motion?
Aye.
Aye.
Are any opposed? Okay, motion carries, and the minutes from June 12th have been approved. And then, Mr. Roos, I think that you are going to give us just the status of the Navigator and Enroller Assister grant agreements, item number 8 on the agenda.
Yes, for the record, Shauna DeRuse. Sorry. So since the last board meeting, we have been negotiating with the different organizations. We have not signed all of the agreements. Some of these organizations, like us, had boards that they needed to take the agreements back to and get approval on. So we have a couple out there that have not been signed yet. Of the ones that have been signed, we've come to an agreement on the amount. We've come to an agreement on the targeted enrollment. If you recall from the last board meeting, that we said that from the statistics that we showed, there would be approximately 50,000 targeted enrollment through navigators. And of the numbers that each of the organizations feel that they can help us enroll, we are going to hit that target. With the navigator funding, assister funding, and also we funded some certified application counselors through these grants. We will have about 110 individuals certified as an EEF through the Division of Insurance to help us fulfill that targeted enrollment. There were varying degrees of awarded amounts depending on what they were going to do, how many people they were going to hire, what their target was, whether they were statewide or just northern or southern. We hit the amounts. We talked about, approximately 73% or so of the funding being in the south versus the north. We hit those targeted amounts, and we hit about an average enrollment target varying plus or minus, say, $5, but about $55 per enrollee is about that target cost of what those grantees will be shooting for. So depending, they say each organization say that they're going to enroll. Some were lower. I think the lowest one, an organization was targeting about 3,000. Some are much higher, 20,000. So it just depends again on whether you're a statewide or just north or just the south. So we have five signed agreements at this time, and hope to have the rest of them signed very, very shortly. And we've provided, we've had 2 grantee meetings. We've provided them with the information regarding the upcoming certification that they'll be able to go through at the DOI. We have really started collaborating as a group, not just the individual organizations, but as a group, helping each other out, putting those thoughts and concerns out on the table, because everybody has them, and you think you're the only one that has them. So coming up with some really good collaborative ideas on how to overcome those situations. And even down to if you have an event that has 1,000 people at it, you might want one booth from the Nevada HealthLink, but if you have a 30,000 person event, you might want all 6, in Southern Nevada, as well as KPS3's booth that can push people over and let them get helped by one of the organizations. So we've gotten a list not only of the organizations that we are subgranting with, but I think it was so impressive that we have, I think, over 100 partner organizations that all of those organizations are working with. And we will provide that list. We're putting it together. We will provide that in a future board report for you all to see just how extensive this network is going to go throughout the state of Nevada. So that's a real quick overview, and I can take any questions if you have any.
LaVon Lewis, I have one question. Did you have one group that dropped out for being navigators?
There was one organization that when we started doing the negotiating, if you recall from the last board meeting, we talked about the fact that when the RFA originally hit the street, we talked about our funding was all the way through next December. And really, though, when we started talking about how this was going to work, we really pulled back and we decided to focus on through the first enrollment, so that those grants are being written through the time period of March 31st, through the end of the first open enrollment. Some of the concerns then surrounded, well, what do you do with these people? You're hiring them. What do we do with them in the meantime? And one of the organizations just felt that it didn't fit into their organizational philosophy to do that. They don't hire temporary staff, which is what a lot of the organizations do. They just don't do that as an organization. And they decided that even though the possibility was there that these grants would be extended once we've got through that first open enrollment, that they just kind of decided to wait and see. And we offered up the opportunity for them to have some staff trained as CACs, as certified application counselors, and they took us up on that offer. So the organization will still be involved. So we're glad of that.
So, Mr. Roos, once you get all of the agreements signed, then you will give us a listing of those organizations and the amount of the grants?
I absolutely will. We will, I believe that we had talked previously about posting those on our website.
Okay.
They will become public documents. We will post it. We are revamping our Navigator page. Currently, it still has a lot of the information about the RFA and the mandatory meetings that were happening. And we will be going forward with a lot of the new training materials, the grants themselves, events. We have a new events calendar that all of the grantees will be using so that everybody can go there to see where all of those organizations will be. And a lot of we call it the cheat sheets. We're putting out a lot of information so that people can learn about the different areas of the ACA and what to tell people. So this is going to be our centralized place. And so a lot of that information will be out on our website.
Any other questions for Mr. Roos? All right, thank you very much.
No,
Madam Chair, we have questions here.
I have one more question. Will organizations that are not navigators be able to get information about when the classes are going to be held to get certified application counselors?
Absolutely.
Because I know a couple of organizations that really want to do that.
You bet, you bet. We're getting calls on that every day. So one of the things that we are putting together right now is kind of an application. If you recall, a lot of, we got applications in from the advisory committees way back when, in the beginning of this, seems like forever ago. So we're going to have an application to become a CAC on our website, and people can let us know how many, what they do, who they serve, that kind of thing. And it will help us sort through and see how far our funding needs to go. And so that is also a section on that Navigator Assister Certified Application Counselor page. So that will be a prominent banner coming soon.
I was going to say, just to you, I mean, I appreciate the reason that the grants are short-term, but in terms of training people, it seems pretty inefficient to hire temporary employees, let them go, rehire them a few months later, train a new set of temporary employees. So just, obviously you have to see how things shake out, but that's not a very efficient process.
And we're looking at different ways to do it. I just know that there at least is one organization who's doing that. Other organizations are just fully utilizing the staff that they currently have. So it really does depend on who they are and what their infrastructure is currently. One of the issues is that assisters, of which we have more assisters than we have navigators because we have more assister funding than navigator funding, assisters are essentially done with their job after March 31st. Navigators can function through the summer months all the way running up until that next open enrollment. But assisters are done. There's no one for them to really to enroll at that point. And so there is that, what do we do with them? We've hired them, we've trained them, what do we do with them at that point? And so we're working, again, as a group, collaboration, we're coming up with ideas on how to overcome some of these issues. And we will continue to bring that back to the board and report on our progress.
Any other questions? All right. Thank you, Mr. Bruce. I appreciate your report, and we look forward to seeing finalized agreements and all the information that goes along with that.
Thank you.
All right, let's move back to agenda item number 4, which is the Executive Director's Report. Mr. Hager.
Good afternoon. For the record, John Hager. In the report on page 2, you see several federal regulations. We submitted comments for the first item on July 2nd. Those are available on our website for review. Another set of comments are due July 19th, so we hope to have comments, if appropriate, to the board soon. And then final regulations were also issued. One item not seen here is on Friday, CMS issued regulations that were 606 pages. Didn't have a chance to put them in here, let alone read them yet. So we're working through that. And I imagine they're proposed regulations, so I imagine we will have some comments on those as well. How could you not have comments on something that's that large? But technical implementation is going well. The federal final design, detailed design review, or FDDR, was completed with only some minor details that required follow-up. The next review is in September, first week of September. It's an on-site operational readiness review. Those reviews are important to allow us to have access to the remaining grant funding. So every time we complete a phase of review, we get additional funding. We get to use additional funding for our deliverables to pay our vendors, et cetera. Xerox has almost completed its formal contract deliverables. You see another 3 items that were added to our list. If you look at the Xerox contract webpage, you see some, 60, 70 deliverables at this point. So they have been putting out a lot of material that we have been trying to read and provide feedback on, and that the final documents are available on the website. Attachment A includes a high-level roadmap of all of the items that we have, of the milestones that have been at in that process. As of right now, we are on schedule. At any time, that could go ahead of schedule or behind schedule. We think we've got appropriate procedures in place to keep us on schedule and the appropriate resources. But this is a complicated project, so just want to keep everybody aware. There are a few things that have slipped, and that item is attachment B. The list is on page 3. So qualified health plan decertification process has not yet been designed. One of the reasons, as we're going through this process and we realize that we need more resources or have enough resources to do what we originally scheduled to do, we are going through a process with Xerox to determine what needs to be done immediately and what can wait. We don't anticipate that any qualified health plans will require decertification, but we will set up a process to do that. The process, the IT process in the back end is basically a switch to flip off a plan and to provide notices to individuals to move them onto other plans. And so if that were required, it would certainly not be required until people are actually on a plan in January. So we have some time for that. So that has been put back. Auto renewals and auto redeterminations won't be required until September, October of 2014. So we are putting off creating that process as well. It's not necessary for October of this year. There is a process that we have agreed to with Access Nevada, which is through the Department of Health and Human Services and the Division of Welfare and Supportive Services. Access Nevada is currently the web portal that is used by consumers to enroll in Medicaid, CHIP, SNAP, TANF, there may be some other items. The process to enroll in Medicaid and CHIP is being shifted to the BOSS, to the Business Operations Solution, to Nevada Health Link. However, SNAP and TANF will still be applied for through Access Nevada. Because of the back-end requirements and the data synchronization issues, through talking this over with welfare and Medicaid and determining the best way to do this, we decided that we need to have single accounts for everybody. And so what's going to happen is when somebody goes on to Access Nevada for SNAP and TANF, it will redirect them to the Nevada Health Link. They'll create their login, and then they're supposed to go immediately auto-direct back to Access Nevada to continue with the application process. That auto-direct process is not completed. It won't be completed for a few more weeks past open enrollment, to the beginning of open enrollment, so probably November. In the meantime, the individuals that do that will be told that they need to go back to that previous website once they get their login. There are automated document management workflows that will not be in process until mid-November. However, those items will be kept up with through manual processes, and so Xerox is working on their staffing plan to make sure that they have enough workforce to manage those on a manual basis. The tribal group billing and employer list billing functionality will be delayed as well, and we're working through those processes. And then we discussed either last board meeting or the meeting prior to that, a sort function for Medicaid Managed Care Organization transition QHPs, and that sort function will not be available immediately, but we will be working on providing that function sometime during the first half of open enrollment. So more details on that can be found in Attachment B. The carrier onboarding meetings, we continue to have one-on-one meetings to provide guidance to the interested carriers on multiple subjects. They provide technical assistance in putting the information into SURF and all of our technical requirements to make sure that the plans can be displayed side by side. We are in the process of testing. Many of the organizations have completed their connectivity testing, and they're working on some of the scenario testing. Once we have the plans certified around August 1st, we will put that actual data into the system, and we will have actual data to test, and then to test to make sure it gets into the system, and then the carriers will also then be able to test the data to make sure it's properly displaying their plans, to make sure that there aren't any errors during open enrollment. We spoke about the Navigator Enrollment Assister, the training for those programs for the exchange enrollment facilitators. The certification instructions have been developed. Pre-certification training will be finalized in the next 2 weeks, and approved training should be available by August 1st. All test questions have been weighted for difficulty, and a final test will be ready in August. So we're moving forward with that, and we seem to be on schedule, and really appreciate the help from the Division of Insurance. Not the help, they're actually running. We're providing the help, and we really appreciate their help as well as our staff. Mr. Haycock has put a lot of effort into assisting the DOI on that as well. Marketing and advertising, we'll talk about that in agenda item number 5. You can see our upcoming events and deadlines and our board calendar. With that, I'll be happy to take any questions.
Do we have any questions for Mr. Hager?
Yeah, this is Ron Klein. John, I'm sorry I haven't been able to go through 606 pages since Friday. thought you read faster than that. But based on CNBC and CNN or whatever it is, that rule basically says, as I understand it, that the federal government is not going to require income verification. And I was talking to Sean, and I'm confused because my understanding was that there's a real-time link between the IRS with the Federal Data Hub and our program that provide verified income. And then Shauna was saying that wasn't true, that if I understood correctly, there was attestation. And now, if I understand correctly, that's going to be delayed for a year. So at least whatever you understand, can you clarify that?
For the record, John Hager, I will try to do my best, again, without having read the entire document yet. My understanding is that the income verification process is optional for exchanges. It's not required, but we can do it. And actually, there were two announcements that happened last week that kind of go hand in hand. One was the announcement that the employer mandate has been postponed, so that employers will not be taxed for not providing insurance to their employees. The other one was that this one that you were talking about not requiring income verification. There were several blogs that immediately came out with, oh, well, that's because the Federal Data Hub won't be ready on time. And what they said was, well, the hub won't be ready because you have to verify APTC because APTC is a trigger for having the employer penalty. And I don't think that's correct for a couple of reasons. First of all, the income data provided by the hub is from the IRS. Now, the issue with the IRS data is that it is delayed data. It's taxed in 2012. There might be some quarterly income data in it, but that is also delayed. And so it's not necessarily a perfect representation for the income data that is appropriate to determine your APTC in 2014. So there was always going to be some attestation required of, well, I expect to make this amount of money. There are certain thresholds that if your income does not match that APTC data, that data from the Federal Data Hub, you would be required to verify that. And so I believe that the regulation, the announcement on Friday about that regulation was that the exchange is not required to verify that. However, I will say that we have built our processes to verify it, and we are in the testing process, and I don't know if it's appropriate to stop that process at this point. We have sent a letter to HHS indicating that, and this was about a month and a half ago, indicating that any additional regs that they submit, we're not sure we will be able to comply with them by October. That said, this is a regulation of flexibility, but given that we are ready to go, I don't think that's necessary. The other issue was that people said, well, the employer service, the service that provides whether or not an individual has employer-based coverage, is not available from the hub. And actually, about 6 months ago, there were a lot of conversations about where do you get information on whether somebody has employer-based coverage. The hub was designed to provide a service that indicates if you have a federal program such as Medicare, TRICARE, VA, et cetera, but it was never intended to provide an all-encompassing database for all employers in the country. There is no such data source, and the hub is really linking you to other data sources. So that data source has to be built. It is not ready and was not expected to be ready by 2014. So because all the testing seems to be going well, and because all of the services that we were knowledgeable about seem to be testing fine, I don't think that the data hub is going to have a problem. And I don't think as long as that regulation is in fact a flexible regulation, I don't think we'll have any problems being able to comply or continue with what we're doing.
So what you're saying is that the delay in the attestation and the verification speaks not to the Federal Data Hub not being ready to go, but other state software programs, not ours, not being ready to go.
And potentially the FFE, correct. The functionality to check whether or not you are covered under employer-based insurance when you apply for APTC was an exchange function. And the way that we are going to do it is when you apply for APTC, we ask you who your employer is, and we send a letter to your employer indicating whether or not, or indicating that your employee has enrolled in APTC and therefore you may be liable for a tax penalty. And so that statement might change to, your employee has enrolled in APTC, and if they continue to be enrolled, you might be liable for a tax penalty next year, but not this year. So there might be a slight nuanced change to that letter. The difficulty, though, is that we can send a letter to the address provided to us. We won't know for sure whether or not that address is correct. We won't know if that person is providing us an address to their supervisor in a company with 10,000 people, and the supervisor says, I don't know what this is, and throws it away, as opposed to going to their HR folks. So there's a lot of issues with that, and we intend to follow the process that was originally laid out in the regulation. It may not be a perfect process, and it's going to take some time before that process gets better. But I think that is where some of the problem is dealing with the fact that letter may not get to the right person, and that might be why that employer mandate penalty was pushed off a year.
Do we have any other questions for Mr. Hager? All right, thank you for your report. Let's move on to the marketing update and presentation by KPS 3.
For the record, CJ Bowden, I'd like to introduce Rob Gadke from KPS 3 while he's getting everything set up in an ongoing effort to keep the board apprised of all of our marketing and outreach efforts. We're going to be doing a monthly or per board meeting announcement as we go forward, moving up into the October open enrollment, and then through the open enrollment as we go and progress with our different stages in marketing. And with that, I will hand it over to Rob to give a brief marketing outlay, and then I'd also ask Rosemary Flores in the South to come forward. She will be doing a marketing and outreach update and our in-person assistance in the South.
Thank you, CJ. Rob Gadke for the record. And like CJ said, Rosemary will be delivering half of this presentation in Las Vegas, and I will turn it over to her in just a second. So our topics for today are to review the overall timeline for the campaign through Phase 2 and Phase 3, provide an update on the campaign itself, what the creative execution looks like, where we're going to be running it, and who we're going after. Then I will turn it over to Rosemary to provide an update on the outreach efforts and education, and then open it to the floor for questions and answers. So to review our timeline, we've seen this, and it's very small, so I'll give you the highlights. But anything that you see up there in green is essentially our Phase 1, which was the research and information gathering stage that has been completed. And we are deep in the heart of the maroon phase now, Phase 2, the education component, which is comprised of our first launch of media as well as our education and outreach program. Our first media will hit newspapers, radio stations, and digital components this Monday, July 15th, and that phase will conclude on September 30th. Directly after that, we will open it up to Phase 3, which is our call to action to actually sign up and enroll on NevadaHealthLink.com and move forward with some more exciting outreach components, including door-to-door campaigns, and again, Rosemary will get into those later. So moving forward with our campaign update, right now I'm just going to go through again some of the research that was done to develop this idea, this concept. I'm going to share some of the concept with you guys today. Talk a little bit about our paid media strategy, what our objectives were, who we're going after, and what our estimated reach numbers are, and then go through the paid media mix as well. So let's start with the research. Again, everything that we've done to date has been research-driven, and we developed a strategic brief that everybody has seen and read. Then working with the exchange staff, we identified our core targets, who we were going after, and developed a campaign approach to get these folks to log on to the website and sign up, or call and contact a navigator. From there, we developed several campaign options, several creative approaches that would meet our goals. And we put those in front of focus groups to see what their reactions were to them, and also to provide some insights. Further, to add to our research, we did some cognitive testing that not only tested what people spoke out loud, but what their internal mechanism were actually telling them to do. So that was really fascinating stuff, and I think it helped sort of direct our creative approach. And then I would like to give a very special thanks to everybody on the working group for all of their great input, their fast turnarounds, and all of their insight. It's been greatly appreciated, and it's helped kind of move us forward. And then finally, just to put a name on top of our campaign, it is called Honest, and that is the campaign that not only the focus groups and our target audience selected, but also everybody collectively agreed upon as the approach. So I'm going to get into that and kind of talk a little bit more about why we went this route and what it was. The first piece that came loud and clear was that they wanted a campaign that was true. This is a government organization. They didn't want fluff, and they didn't want anything extra. They wanted the truth. So in our focus groups, we had comments like, this campaign is the truth. This immediately grabs your attention, and you want to know more. This ad really made me think I need to call and get some more information. On the Spanish side, very similar to True, they wanted a real campaign, something that rang true to them and that was relatable. So in the Spanish focus groups, we had this ad is reality. It gives me panic not to have insurance. You do get a bit scared if you don't have medical protection for the family. This ad made me think of the economy and how I could make it possible to be able to pay for insurance if I were in this situation. So with that, Honest was chosen, and now I'm going to go through just a few samples so everybody can kind of see what the print samples will look like. We did produce 10 executions, so 10 different stories for all of these campaigns. And the first one that I will read, and then I'll just show the other ones, but I work hard for my family, but we don't have health insurance, and that scares me. And then we do have a boilerplate type message that is on everything to deliver all of our points. The new healthcare law requires all of us to have health insurance by 2014. Nevada HealthLink is here to protect you from a fine on your taxes by helping you purchase state-approved health insurance plans that are high quality and based on your income, regardless of a previous health condition or the amount you pay. Learn about the changes now by visiting NevadaHealthLink.com or by calling 8557-NV-LINK. Plans are available for purchase starting in October, sponsored by the state of Nevada. Like I said, we do have 10 executions, all focusing in on our target audiences. This one is directed specifically for Spanish-speaking sick and worried audience. So this woman's story talks about asthma and how it's expensive without health insurance. And then a young invincible. I'm healthy, but my mom still worries. She's scared because I don't have health insurance. This is kind of a two-prong approach to go after mothers to help their young invincible children purchase health insurance. I'll read you a sample TV. This is the radio is going to mirror this campaign. So the stories are a little bit lengthier in television, which I think has a much stronger impact. That's why we're devoting quite a lot of our media dollars to television. But we have 2 kids, 3 jobs, and a lot going on. It's not easy, but we always have food on the table and shoes on our feet. We find the time to do what we got to do. Luckily, we have our health, but we don't have health insurance. And that's what makes me nervous, in case, something happens, and I don't like that feeling. And then the spot continues on to read the boilerplate and everything that Nevada HealthLink stands for and what it can do. So those are some samples of the television. Like I say, we have print, television, and I'll get into the complete mix, but we wanted to share with you some of the executions to date. Talking about the audiences, so we have our approach, we have our campaign, and we're going after these 4 key markets here, and all of them have the qualifier of being within the 138 to 400% poverty level line. And we are going after Hispanics 18 to 54, younger families with children 18 to 34, young invincibles 21 through 29, and then the sick and worried, which has a smaller allocation of focus at 34 to 64. When we get into the paid media component of the plan, this is what drives where we're purchasing placement. And our objectives here were fourfold, but the overarching objective was to just generate awareness about Nevada HealthLink, especially during our education phase. And then our secondary goal here is to simply surround these buckets of audiences with a mix of both traditional and non-traditional. So not only will they hear a radio spot, but when they're clicking around on their computer, they'll see a digital ad. If they're watching YouTube, they'll get a pre-roll of our message, etc. When we switch over to phase 3, the objective here is to now not only provide education, but also to get folks to enroll. So that's when we'll have a much harder message to actually enroll at NevadaHealthLink.com. And finally and ultimately, everything aside, our goal is to get 118,000 Nevadans enrolled in NevadaHealthLink.com. Moving on to the planning and research component of the media plan, this is really our approach here. And what we wanted to do is take the allocated dollar amounts and create a plan that delivered the most reach, so reached the most amount of people within our target, obviously with the constraint of our budget. Just to provide a little bit of clarification, when I refer to reach, that is the actual number of individuals or households that are exposed to our message. And our projected total campaign reach is 83%. So of those 4 key target markets, 83.4% of those folks should deliver or should be exposed to one of our messages. When I talk about frequency, that's our next target, and frequency is essentially they're exposed to the message, but how many messages will they see in the duration of this campaign? And our estimation for our frequency is 23.7 exposures to our media. So 23, almost 24 times somebody will be exposed to our message. All of this together collectively has a projected campaign impression amount of 39.77 million. And that is a very conservative number when we put them on the paper, and we will be reporting on those weekly with the exchange staff. When it comes to our paid media mix and timing here, essentially our media mix is going to be print, digital, which encompasses video, banner ads, mobile and in-app advertising, and then radio, television, and out-of-home. The print, the digital, and the radio will start this Monday, followed up in September with our television spots. And just to clarify the reasoning behind that, viewership in the summertime is quite low. So we get a much higher frequency, much higher distribution in our other channels. And then once viewership picks back up, come September 15th, we will start airing our television spots. And then our out-of-home starts in October, which consists of billboards, bus wraps, signage, anything outside. To sum up our media budgets, just to give you some dollar amounts here, our Phase 2 media budget is $634,766. Our Phase 3 media budget is much greater. The length of that campaign is 6 months versus a 10-week schedule in Phase 2, and that is $2,164,000. Just to clarify, this is statewide, Northern Nevada, Southern Nevada, and rural, and the amount of dollars spent in each of those regions correlates directly with the population that resides in our target market. So the bigger the audience, the more effort we're putting into those regions. As a added value component on the media spend, because of the budgets and negotiations, this Phase 2 will see an extra $150,000 worth of added value media, so free placements, free spots, free airtime, interviews for the exchange staff on radio and television, etc. So that's our negotiated value for there, and the campaign value goal for both Phase 2 and 3 is $700,000. Getting into our next steps here, leaving today and finishing up all of the delivery of the advertisements that start on Monday, and then moving directly into our TV and out-of-home, the billboards and the bus wraps, etc. And then shortly after, we will start recording and developing all of our Phase 3 campaign materials. Luckily, we have a little bit more time there, so hopefully the working group will have a little more review cycle on those. And then, as always, measuring, adjusting, and reporting. We do have quite a lot of measurement components in place. So as the numbers come in, we will be adjusting this and tailoring our messages, showing different message points to different audiences to make sure we're achieving the best conversion rates. So with that, I'm going to turn it over to Rosemary out in Las Vegas and to deliver the outreach update.
Rosemary Flores, KPC Marketing. I'm the Southern Nevada manager for the outreach, and we'll be talking to you about the outreach and education, updating you on who our Nevada HealthLink outreach team is, what the outreach strategy and plan looks like. I'll share with you the matrix to how it is that we're capturing the numbers, and you'll hear some responses from the community. On page 23, you'll see the Nevada HealthLink outreach team. In Northern Nevada, we have Oscar Delgado, who is managing the northern part of the state. Judy Fleischman is our outreach coordinator statewide, and we recently hired Sherry Suggs here in Southern Nevada to be our outreach liaison. In Northern Nevada, we have Edith Wynn, and she is the outreach liaison up north. In addition, we have approximately 10 per diem staff, and they're the ones who are staffing many of the events and also providing distribution to sites. So what's our strategy, our outreach strategy? We are aligning our activities with events and organizations that effectively reach our target population. So as we are identifying these events, we are always looking at that target population. We make an effort to be present at these events, at the festivals, and at neighborhood gatherings. We're partnering with nonprofit organizations, including the churches and some of the clinics. We're also partnering with state, county, and school-based organizations. And in fact, this week we'll be working with some of the colleges and universities. We are already beginning to receive requests for presentations. So we are doing some statewide. And at the grassroots level, we're doing the person-to-person approach, and that's one of the areas where we think is very critical. I think it's very important for us to build trust in the community, for people to get to know what Nevada HealthLink is. Later on, you'll hear from the field where they really needed to have some type of indication Nevada HealthLink is a Nevada-sponsored entity. So the outreach, we will assume 70 outreach events throughout the state in phase 2, and that will end in September 30th. Our estimated reach through phase 2 is 330,000 Nevadans. We're constantly updating the calendar of events on the NevadaHealthLink.com every day. Coming up during phase 3, between October and March, we plan to reach 736,000 more people. We are also going to be starting the door-to-door campaign, and that will be statewide. We've included an in-home visitation, and that's again to build trust and to work with communities where many times they do not go beyond their neighborhoods. So we're going to penetrate the community as much as we can through the in-home visitations. And we also are working with the northern and southern superintendents to include the initiative within the schools, and they've both been very receptive to this idea. As far as metrics, how are we capturing the numbers? We measure the touch points by attendance, and that's what we're calling impressions. So we're also including those one-on-one conversations, and those conversations take a little bit more time, but those conversations are critical because we receive so much out of those conversations, and also the number of materials we're distributing to sites. We track each activity cost against the total budget. During phase 2, the consumer outreach budget is $220,000. During phase 3, the consumer outreach budget is $730,000. Once we capture the cost per event, we then calculate the cost per touch. And that touch point is for each outreach activity. So on page 27, you'll see what the numbers are to date. Actually, what the numbers are as of July 8th, and these are statewide. We have been visible through 103,191 impressions. We've had 6,371 one-on-one conversations, so over 6,000 one-on-one conversations. And we've distributed over 22,000 pieces of literature, 22,334. And from that, the average cost per touch is calculated to be 40 cents. So what has been our community response? Because our per diemers are trained to be out in the community to really listen. In fact, many times you'll see at our events that our per diem staff is outside of the table. They're not behind the table. Because that's the approach we're taking, is to build that relationship. And some of the questions that they are asking, first of all, they began to ask, is HealthLink a private business? Is there a number I can call? Is there a location I can go to for additional information? And as people are asking these questions, and once they know that this is a state-sponsored entity, many people are expressing that anticipation for enrollment to begin. Some are indicating that there's no need for insurance, but immediately they know that they have a daughter, a son, or somebody in their family or their neighborhood needs insurance. And we actually see them roll up a piece of paper, put it in their pocket, and say, I'm taking this to so-and-so. So it does make an impact. We know that that information is going to expand. It'll go beyond. The one main thing that came out of the field was to have that stronger presence indicating state sponsorship. We were listening to the confusion about Nevada HealthLink because when we're at events, there are other companies at the events, including carriers and including other entities that want to market themselves. So they were very confused because they wouldn't see anything that said Nevada sponsored. So immediately as we heard that information, we fed it up to the state, to the exchange, to KPS3, and the KPS3 team has already now, as you can see in the new materials, it indicates that we are sponsored by the state of Nevada. So that's going to help tremendously. There was also a phrase added in the text indicating that there are state-approved health plans. So that's really going to clarify a lot of questions. The one aha information that we heard from the field, and this actually targets the young invincibles. We were seeing young veterans approach us and tell us that because they're no longer in either the Army or Marines or any of the veteran forces, and because they have not retired, they do not necessarily have insurance. So that was a real aha moment for us, and we're already beginning to make connections with Veteran Affairs to be able to reach out to them as well. And that's my presentation.
Thank you, Rosemary. With that, we'd like to open it up for questions for anybody.
Do any of the board members have questions?
Go ahead. Yes, we have a few questions down here.
Lavon Lewis, media outreach. Does that include radio, and does that include ethnic radio? You know, those groups that are represented primarily Hispanic radio, KCP, which is a large African American outlet. It does include that.
Most definitely. There are quite a lot of media buys on ethnic radio and all of the media stations, as well as our digital approach. You will see quite a lot of ads targeted directly to that audience on specific websites.
For the record, CJ Bowden, just to follow that up, in the Northern Nevada, we're contracted with one Hispanic radio source, and in Southern Nevada, we are on 4 Hispanic radio stations starting on Monday.
Thank you. Any other questions?
Lamont Lewis, one further question. Did you mention any primarily African-American radio?
Yes, we have outreach on many of the urban stations, especially in Southern Nevada, but also in Northern Nevada. And I don't have those numbers off the top of my head, but we do have presence on multiple urban stations in both locations.
Well, I know that KCEP is one radio station down in Southern Nevada that is a very, largely has a large African-American appeal.
I was just looking into our media buyer, Fong Manente of KPS3, and she is confirming that we are advertising on that station.
Thank you.
Any other questions?
Yes, Lynn Atkins. I have a couple questions. Is it possible to get a list of maybe where we're buying media, what stations, north, south, and in the rurals would be my first question. And then my second question is on future reports. I think it would be really helpful, at least to me, if we could see some of the breakdown again from Southern Nevada, Northern Nevada, and the rurals on outreach, the numbers. I mean, these are really great numbers, and it's very, very impressive. But I think we'd like to see, or I'd like to see, I'm getting a couple nods with me, but would like to see a little bit more breakdown, a little bit more detail on the outreach efforts and the media buy, and a little bit more detail with the television and radio. So that's one request. And then I just have a broader question. Obviously, as John was talking about at the beginning with the new announcements from the administration, I think just last week and maybe the week before, it seems to be confusing, an already incredibly confusing process as far as the health exchanges. And I was just wondering if there's been any discussion, if there needs to be any discussion about messaging and changing our message, or amending our message to kind of talk about the fact that because these regulations have come down, that doesn't necessarily affect the individual mandate. I just wonder what people are thinking who don't really know much about this anyway, and so we are doing an initial education to them, and I don't know if there's been any discussion about the cloud that's kind of been cast upon us.
Absolutely. For the record, CJ Bowden. To answer the first question, I actually have a list I will send out to the board right after this. Ads, where those will be placed, the frequency they'll be placed at each station, and the reach that we're looking for from each audience on that. I will make sure as we move into the future phases that you have the breakout by cost that we're spending with each television station as well. And we can break it down into a very simple to read grid that you can see exactly where we're placing and what we're spending. To move on to the second question, we've already started in our non-paid media with outreach, letting people know that the employer mandate has nothing to do with the individual mandate. I appeared on a radio show yesterday in Las Vegas to start getting that message out, and we're moving forward to make sure that the audience knows that there is still the requirement for individuals to have health insurance, and the delays on the federal level have not changed any of the individual mandate or individual requirements to purchase health insurance moving into the future. We're going to look at that on a broader aspect and look at that probably moving into phase 3 and our phase 3 goals, but we have a very flexible campaign on our digital side, and we can look at all the digital and immediately change those messages if we have one that's not resonating, or if we find that we need to address another portion, we can immediately change the digital within literally a matter of days rather than weeks.
Thank you.
I think Mr. Hager wanted to add a little bit to that too.
Absolutely. For the record, John Hager. So if you'll recall from the presentation, the media information indicates that we're protecting you from a fine. So the messaging is still consistent with the messaging that we've created is still consistent with the current message from Washington, and probably the best place to overcome the confusion that we've just heard from this last couple of weeks is mostly in the news, radio interviews, and that kind of thing, radio and television interviews. And like Mr. Bowden said, we are working on those, doing those interviews already. We have indicated several times that just because the employer mandate has gone away for a year, it doesn't mean that the individual mandate's gone away. So I think that we're consistent. I think, and hopefully there aren't any more changes that make these inconsistent. I don't anticipate any. But I think at this point we're following a good flow or process to make sure that Nevadans understand what's going on.
Any other questions? And we thank you all for your presentation. That was great. We'll look forward to updates at the next board meeting as well. Thank you.
Thank you very much.
All right, let's move on to agenda item number 6, and after that, I think we'll take maybe a 5-minute break. This is a report given by Mr. McNeil. The board has asked staff to give us a report on security measures, since we do have Social Security numbers and a lot of personal information sitting out there. So, Mr. McNeil, can you give us an update, please?
This is George McNeil for the record. In front of you is the security measures for the Nevada Health Link web portal. The purpose of this document was to describe, in summary, the protections and safeguards around personal identifiable information collected and used by the Nevada Health Link portal. It's broken down basically into 5 subjects: data collections and standards, firewalls, encryptions, intrusion prevention systems, monitoring and alerts, infrastructure, and public access. Public access also includes our partners, the brokers, and the navigators. At this point, I'll go ahead and take questions.
Do any of the board members have questions regarding the security measures?
Yeah, this is Ron Klein. So this is not what I do for a living. And all I know is there are a lot of big corporations throughout the United States that have these wonderful systems that get broken into all the time. So make me feel better that not being an expert in this, excuse me, somehow you've learned we're putting in place that aren't as easily broken into as General Electric, GM, the Defense Department, Bank of America, Wells Fargo, What's I guess what I'm asking in a non-sarcastic way, I'll say, all these companies have all these things to get broken into, so how are we better?
Well, I have had this is George McNeil for the record. I have had a background check, not completed by Booz Allen. There is no way of really telling you that there is no way somebody's going to be able to get in there. And the reason being is that these systems are all created by man, and no matter how smart you are, wow. Try this one more time. So no matter how smart you are, there is somebody else standing beside you that is probably a little bit smarter in a different aspect of those rules. So as we look into how we transport data and how we store data, we want to ensure that we have an encryption protocol that's out there for transportation of the data. And then also, while data is at rest, another piece of that is to encrypt it when we write it down to the hard drive. And again, encryption is also, a mathematical algorithm that's created by man and can be hacked by man. If you look out on the web, out on the internet, there are a number of different sites that will show you how to break WEP protocol, WEP-A protocol, which is the stuff that we use today within the exchange for our public wireless system. There are different ones out there now. By the way, our exchange public wireless system is not connected to the state of Nevada. Okay. But those encryption protocols are out there to help slow down the hackers. There are, I've taken a number of classes describing or working with different white hat hackers, And they're out there. Those people, those bad people are out there to do bad things. The best we can do is encrypt our data, ensuring that it is to the utmost of the industry standard today. Now, there's a lot of different standards out there. There's NIST 800.53. We're compliant within that. So we're working towards ensuring that data will not be stolen. Now, there's hopefully they'll go after the FFE long before they come after us.
Mr. McNeil, I wanted to ask a question. I know on some of the other boards that I serve on in the private sector where, this, first of all, it's a public relations problem when you have this happen, besides the security problem. But a lot of those companies actually pay the professional hacker teams to come in and try and penetrate your system. And when they find the flaw, then you can come in and correct it. But they do that not, infrequently, but fairly frequently to make sure that there aren't any flaws in your system because it is created by a man. Have you thought about doing that with this system?
George McNeil for the record. Yes, actually, the state of Nevada itself has different teams or different contracts that come in, and they will do penetration testing on our networks here. Now, because our data for the exchange will not be stored within the state of Nevada, but we will be using it to transport data, okay? We also, within the contract for Xerox and their data centers, they already have intrusion prevention systems in place, and they also do penetration testing, I got too fast again, on an annual basis, or on a periodic basis. I won't say it's annual because we don't have that information in front of us.
Okay. Mr. McNeil, could you provide for the board just a brief summary of each of those 5 sections? I think that might be helpful.
George McNeil for the record. The data collection and standards, the consumer information collected during the application process is used to ensure correct enrollment and placement in a qualified health plan. Process to collect information is provided only to those needed to support the consumer. So we already have security roles and processes in place for anyone that is looking at that data as far as the CSRs or anybody from within our own internal networks. Firewalls and encryption and intrusion protection. These systems are in place to protect data while in transit and storage. Each provides a separate layer of protection that when combined meets or exceeds the industry standards. Now, if you only have one of these protections, you're going to stop some of the people. By having all 3 of them, also within that, when we set up our servers and different things like that, we're using the industry standards, whereas we're splitting the application, the web portal, and the database off of different servers. Now, by doing that, we eliminate anybody going around the initial server and getting to the database. And that's what we're really caring about here is the database. One record is bad, but if they get the entire database, obviously we're going to have a large breach, and according to NRS, we have to notify the public. The monitoring and alerts, the systems are monitored, is performed 24/7 with systems alerts programmed to alert key personnel should a condition warrant it. So as your hackers start to push against those firewalls, push against those intrusion detection systems, they will start, the monitoring will actually alert key personnel within the data centers that something is going on. So when you have these different attacks, such as a denial of service attack, where they're coming in with a large amount of traffic, these are keying in on key personnel, alerting key personnel, and those personnel are out there to shut down those addresses that are coming in. The state of Nevada itself has, I believe the last count was 10 to 20,000 of these attacks a day coming from overseas. And so we're always stopping those overseas IP addresses from coming into our networks, and we're ensuring that at the intrusion systems, okay? The infrastructure, the distributed nature of the system infrastructure affords the exchange better protections against natural disasters. By making use of virtual technologies, this solution creates a very responsive disaster recovery architecture. We have 7 data systems, or data warehouses. Within those 7, there are 2 or 3 that are key to housing the data that the exchange will be utilizing. They are separated in large geographical areas so that if we have anything that happens as far as a natural disaster, we always have tornadoes, hurricanes, earthquakes, that it may affect one data center but not affect the other. So we have we have this hot site, which is the active, we have a warm backup site, and then we also have a cold site. So by utilizing that virtual technology, we can take that hot site and actually take it to the cold site and be able to put that up in a reasonable amount of time. I won't say it's going to be, tomorrow, but it can be done in a reasonable amount of time. Public access, this is where we started getting in. That's probably the largest piece I put in here. As consumers come to Nevada HealthLink to purchase health plans, we have the responsibility to ensure their identity. The exchange will utilize the identity proofing service provided by the Federal Hub to accomplish this task. These consumers who cannot be identity proofed electronically will be done manually. To help ensure security of our consumers, the brokers and navigators will be required to use multi-factor authentication when accessing consumer records within the Nevada HealthLink. This process allows for higher security standards and meets the requirements of the ACA. Remember, within the ACA, they require us to, 1, be a citizen, be in the country lawfully, I should say, not citizen. But to ensure that we have the right people, let's see how identity proofing, you're going to go out there and use the Experian web portal, and they're going to ask you the similar questions to what you do today with your, with a number of different websites actually, but one of them is the banking websites. They're going to ask you what car you had in 1980, what loan you had for your house, that type of stuff. As you answer those questions, they will be providing a score for you. Depending on how you score is whether or not you will be proofed, as they call it. As far as the navigators and brokers go, the multi-factor authentication, there'll be a piece of software that you'll put down on a phone or on a PC that will provide a changing RSA token, which will, as you're logging in, you'll key this piece of software and it will give you a specific number that will be good for 30 seconds to key in next to your user ID and password. That will give you the multi-factor authentication. Okay, if there's any questions.
Do we have any other questions for Mr. McNeil? All right, why don't we take a 5-minute break then, and we'll come back on the record at, let's make it 9 minutes. We'll, at 2:55, we'll come back on the record, and we will then start with agenda item number 7.
We'll be with you momentarily. Our Dental Plan's interactive website allows members and providers to
All right, everyone, let's get back on the record. Are we ready down in Las Vegas?
Yes, we are.
All right, thank you. The next item on the agenda is agenda item number 7, which is discussion and possible action regarding strategy to provide consumer education related to enrollment and the effective use of health insurance. So, Mr. Hager, are you doing this, or CJ? Thank you. If you would help us, Mr. Bowden.
Thank you, Chair Campbell. For the record, CJ Bowden. This report mirrors our goal number 4 for the exchange that's laid out in the strategic plan, which is to educate the public on the effective education on enrollment in and the effective use of health insurance. Looking at the plan that we have, the first section of this goal is to educate the public on matters relating to enrollment in a qualified health plan. As you've seen, we just had a marketing update, and the folks from KPS3 did an excellent job of laying out our strategy moving forward of what we're going to do for phase 2 and phase 3 of education and enrollment call to action. That includes all of our media buys and our campaigns, as well as our off-camera non-paid, which are the press releases and the different interviews that we do, and moving into the community outreach and direct in-person events that we're attending and family-to-family visitation. That really takes care of the first portion of educating the public on enrollment in health insurance. The second portion of that would be our Navigator and Enrollment Assister program. We have developed a Navigator and Enrollment Assister program and released those grants so that we have the information moving forward that we can give out to these entities to have a congruent message with the exchange, and we're going to provide starter kits so that they have all of the information laid out so it mirrors the information that we're giving. We want to make sure that they're aligned with our message and they're giving the correct information out to the public to avoid misinformation. The Navigator's target on that is to have a reach of 51,100 enrollees approximately. This moves us to the second portion of goal number 4, which is education on the effective use of health insurance. Looking at the population that we have, many of the individuals entering into Nevada Health Link have been uninsured for a long period of time, or they've never had insurance before. Those individuals come to a point of service in using healthcare that is upfront and the first thing that they come to. A lot of those individuals wait and postpone medical care until it becomes critical, and then they use an emergency room or a point of service that is much more expensive than going to the primary care doctor first and using a preventative checkup and hopefully diagnosing these things before they become more serious. That is where education on the effective use of health insurance comes in. If we have a program in place to move forward and look at a 2, 3, and 5-year goal standard to get people educated on the effective use of health insurance, that will directly relate in a reduced overall cost of health insurance for the state of Nevada. We propose to do that in a number of ways. The first is the developmentation of education materials. We want to make sure that we develop clear and concise education materials, multimedia education materials, different videos, info services, infographics, telling people about the different points of service that they can go to and the cost of those different points of service and how important it is to effectively use your health insurance plan to avoid out-of-network charges and to use services that will result in a high quality of service at a lower cost. We're going to go with a partnership with carriers. We propose going to the carriers that are offering QHPs on the exchange and asking them to provide us with a base material of where their networks are at, how do they best educate their consumers on what networks to use. Because if we look today at some of the methods that are out there, different hospitals use their emergency rooms as profit centers. If you drive down the freeway, either in Las Vegas or in Reno, you can see billboards on the side of the road that says only 6-minute wait at this campus emergency room. On an effective use of health insurance, that's a very bad message to be putting out there. So we want to team with the carriers and then team with the providers as well to help reduce those messages going to the public and educate them to use the urgent cares and their primary care physician first and only use the emergency room as a last case scenario. That leads us directly into number 3. Our proposal is to team with healthcare providers. Healthcare providers are the first point of service. If we have this newly insured population going in to use high-cost points of service, the healthcare providers at those points of services can be the first line of defense. If they partner with Nevada HealthLink in our education campaign, they can move forward and let those consumers at those points of service know if they have a condition that can wait or that can be held back, they can go and possibly use an urgent care to help save. The carriers, of course, want this to help reduce cost of insurance. And if we continue with this education pattern and we get the participation of the providers, we will be able to reduce the overall cost of health insurance here in the state of Nevada. Moving on to number 4, we're going to use our community presence to distribute the materials that we create, the different education materials, as well as number 5, the nonprofit organizations and the partnerships that we have with those nonprofit organizations. People that have a relationship with a nonprofit organization that go through and either sign up through the nonprofit organization, maybe through a certified application counselor, or go to that nonprofit organization to use services, they're going to trust the information coming from those nonprofits. So that's more of a person-to-person relationship that we can use to help disseminate this information and get it pushed out to the public. And lastly, we propose using our website, or NevadaHealthLink.com, our enrollment website and resources on the enrollment website, possibly to help push out promotional materials or wellness material packages. Because we have the person's email address or their home address, we can push that information directly to the consumer in the hopes that they will read it and pick up the information that we're putting forward. That wraps up the proposed methods that we have to educate the consumers on enrollment and effective use of health insurance. Our recommendation from staff would be please provide staff with guidance on the development of future methods and a plan moving forward for the effective use of health insurance. With that, I'd be happy to take any questions.
I'll open it up for comments and questions.
One moment. We have a couple down here.
LaVon Lewis for the record, and I don't really want to beat a live and kicking horse, but I do want to just ask a question about the education on matters relating to enrollment in qualified health plans. Item number 1, I suppose, or I. We're running newsprint ads in 12 state newspapers, 8 of which serve a rulership, a readership in rural parts of the state. We are also placing ads in for Spanish newspapers, 2 in Reno and 2 in Las Vegas. And I would just like to request that we also place ads in newspapers that have a readership that is largely African American, like the Las Vegas Sentinel Voice and the Urban Voice, and they also have a large circulation. So I think that we would want to include those ads in those papers. And also I had a question about the next one, which said we're running 60-second spots on 5 major networks in Reno and 4 in Las Vegas, and 4 Hispanic networks in Reno and Las Vegas to convey our message. There again, I think that we would look at that distribution of ads between Reno and Las Vegas, recognizing that the largest population of people who will be participating in the exchange would be in Las Vegas. Thank you.
So that doesn't indicate how many are being done.
This is Lynn. If I can
More
just
will
say one
happen
other
in
thing,
Vegas.
and also I think even the newspaper is assuming just other ethnicities as well. I mean, I just think we just want a broad range of the population that we're reaching out to. So I'm assuming that that's being done.
I'll be happy to provide the board. In our next update, we're going to have matrix that show every media that we are placed in, as well as how much we're spending in each of those placements, as well as the proposed reach of each of those placements. I'll have a grid that will show station by station how many times we're advertising on there, what we're paying for those advertisements, and what our projected reach is. For the limited budget that we have for marketing and advertising, we were looking to reach the most applicable audience that we have in the 138% to 400% FPL in the greatest numbers with those media dollars. There may be some specific newspapers that we did not include in, or some specific television stations that we did not hit, but that would be due to budget constraints rather than not looking at that population.
This is John Hager for the record. We'll take a look at it and provide you with a list of all the newspapers, of the television stations, and we'll make sure that we are we appropriately spread those advertisements.
It's Ron Klein. Besides John's wonderful opening statement at the Health Insurance Exchange Summits, probably the next most amazing thing I heard at those exchange summits was that 40% of the U.S. population thinks that the ACA has been overturned by John Boehner and Mitch McConnell, or the Supreme Court has struck it down, and that 60% of people with income less than $30,000 think the same thing. So it seems like one of the biggest tasks we have is before we teach people how to use health insurance effectively, we have to educate them that the ACA is actually in place and upheld by the Supreme Court and not rescinded. Is that, I don't want to tell you guys how to do your job, but I presume and I hope that's part of the messaging?
Yes, for the record, CJ Bowden. I had skipped over the first portion. We have a $6 million campaign directed directly at letting people know about the ACA, the requirements of the ACA, how, when, what, and where of enrolling in Nevada Health Link. We have a $6 million campaign directed at that. The purpose of this report was to list what we're doing for that campaign, as well as dive into our long-term goal for our strategic plan. And these would be on the 2 to 5 year plan for the effective use of health insurance. Getting the individuals enrolled in the first year is our number one priority, as well as the second year. And then as a long-term goal, the board added the effective use of health insurance to that goal in our strategic plan, and that was an overall cost-cutting measure to help lower the cost of health insurance in the state of Nevada.
And then my second question, Levon's favorite question is about ethnic newspapers, and my favorite question is about the cartoons from Massachusetts that teach people how to use health insurance. Have we made any progress with that? Or, I think probably a lot of people in this room saw Kaiser Family Foundation did like a 3 or 4 minute cartoon video explaining the ACA that, did it. So it seems like educating people with these little cartoons seems to work. Are we looking at that direction in terms of a YouTube channel and doing things like what they are in Massachusetts?
We are moving in that direction. We have procured the rights to use. It's a free use, and we have procured those ads. They're all scrubbed of the Massachusetts Connector logo. Fantastic. And we're going to move forward in branding them with Nevada Health Link logo and putting them out on our YouTube and having links to them on both of our websites.
Wonderful. Great. Thank you very much.
Mr. Bowden, there were a few statements that you made at the beginning of your presentation, and I would be concerned if we use those statements on a go-forward basis. You indicated that the hospitals, emergency rooms are profit centers, and I don't think this agency knows that. Knowing how many hospitals are in the red right now, I think that would cause a problem if we said something like that. On the other hand, educating that our target population, that there are other access points for health care if they feel it's appropriate for their family and what their condition is, teaching them about urgent cares, how to get into their providers. But there may be circumstances where I wouldn't want to steer that target group away from an emergency center if that's what they really needed. So I think that needs to be postured a little bit. I think that whole education process is a good one. And I think it really, you're going to have access to urgent cares in Walmarts and a lot of different places, and that exposure to people, it will be wonderful for them. But to say that blanket statement that that's a profit center for a hospital, I think we don't want to go there. Any other comments or questions? And at this point, is it the approval that you would like from this board is to move forward with an education component. Is that what you're asking us for right now?
We were just asking the board for a recommendation on different ways to move forward with this. We proposed different ways in the 7 things that we've outlined, 6 things that we've outlined in ways that we would like to move forward in the future to help educate the public on the effective use of health insurance, and if the board has anything to add to those, or if they would like to strike one of those from the ways we were moving forward.
What's the pleasure of the board?
Are you on 7?
Yes.
Keep in mind it's not an action item.
It does say possible.
7. Oh, I'm sorry. I misread. Yeah, go for it. Do whatever you want. I thought it was 8. I jumped the gun.
Word of caution. We're okay to move ahead with an action item.
I got them mixed up.
Any comments? Concerns? All right. Sounds like we're taking it under advisement at this point. Is that correct?
Yeah, this is Ron Klein. Maybe just sort of the same as we've said multiple times. If you can just share with us when you actually develop materials to let us look at them before you put them out for public consumption.
For the record, CJ Bowden, absolutely. Everything will come to the board for approval.
Thanks.
All right. Any other comments? All right, doesn't sound like there are, and I think we've given you some direction on what the board would like to see. We've already completed item number 8, and we're moving on to the quarterly staff reports, which is agenda item number 9, and today we have Carrie Eaton that'll make that presentation for us.
Thank you, Carrie Eaton for the record. In your packet, you'll find that we've provided a financial report for the quarter ending June 30th. This quarter marks the fourth quarter, or the end of the state fiscal year 13. The Department of Welfare and Supportive Services has now expended over 3/4 of their authority for the Eligibility Engine project, as we now only have less than 3 months left until we go live. The Governor's Office of Consumer Assistance continues to spend their authority and has expended 39% of their grant authority. Staff has submitted a 4th Level 1 establishment grant application on May 15th, and the approved NOGA was received this week. Staff used this opportunity to request additional funding for outreach and other items. However, this request was predominantly for contractual services, some requiring a match component as they relate specifically to the Eligibility Engine and Division of Welfare and Supportive Services operations. The projects that will be funded by this grant can be found on the table on page 3 in your report. In addition to the funding that DWIS requested, the Exchange has requested funding for a virtual assistant. This is a help function not currently included in the BOSS contract. It will provide for more streamlined experience that should decrease demand on call center resources. Also, CAC certification. Staff intends to develop a CAC certification reimbursement program that will increase the number of CACs in the community to assist individuals to enroll in coverage through the Exchange. Staff has also requested additional funding for potential Xerox change orders so that the program is not delayed due to lack of funding should the need arise for system changes. And marketing, that has been a huge topic of this board meeting. Following discussions with CMS, this additional funding brings our outreach budget in line with the national per capita outreach expenditures. And since the marketing funds were approved, additional funding was approved in this 4th Level 1 grant, an amendment to KPS 3 contract was submitted to the State Budget Office to be included for review at the August 13th Board of Examiners meeting. And this amendment increases the general authority of the contract from its original $6 million to $7,350,000. Finally, the lease for the Southern Nevada office location was approved at the Board of Examiners meeting this week. The space is located in the same facility as our call center and will include a reception area, office space, break room, and conference training room that will be very similar to the setup here in Carson City. And I will be happy to answer any questions on the financial report.
All right, thank you, Ms. Eaton. Any questions from board members to Ms. Eaton on the staff reports?
This is Lynn. The additional funds for KPSB, is that primarily for media buys?
For the record, CJ Bowden, the additional funds for KPS3 go to increase we had 3 weeks at the end of December that we were dead, and then 3 weeks at the end of March that we were dead on television time and radio time, and we wanted to increase that. And then we also put additional funds into increased frequency during the last 3 months of open enrollment to push the message out there. Our federal partners came to us and asked us to add some more for the outreach to bring us up to the national median. And then also we wanted to put 2 additional door-to-door campaigns in, and those funds are inclusive in that as well.
Thank you.
Any other questions on the staff reports? All right, thank you. We'll close that agenda item number 9, and thank you, Ms. Eaton and Mr. Bowden. Was there anything else on that agenda item that we needed to cover, or you feel you covered that enough?
For the record, CJ Bowden, the outreach report for the staff conducted outreach report, we did 22 events over the past 3 months, 10 in Southern Nevada, 11 in Northern Nevada, reaching approximately 2,200 people, inclusive of the summits that we put on. That was the outreach report.
And for those of you listening in, those summits were quite a success. We had over 550 people attending up here in Northern Nevada, sold out crowd there. And in Las Vegas, it was sold out at over 500. We hit maximum at both facilities for that. So congratulations again to staff on all of that. It was job well done. All right, then we will move on now to agenda item number 10. This is possible action for other agenda items and future meeting dates. I would like to ask the board, our next scheduled meeting is August 8th. And I would like to find out from board members, do any of them have conflicts with vacation schedules so we can find out if we're going to have a quorum issue in August? I know it's a heavy vacation month.
Right. This is Ron Lewis, and yes, I will have to miss that meeting for vacation.
Okay, Dr. Klein?
I'll be here.
Okay, Ms. Atkins?
I'll be here.
Okay, and Dr. Ford?
I'll be here.
And Ms. Kerr?
I'll be here.
And I believe Ms. Johnstone will be here. I think we checked with her knowing that she was gone this time. So, and I will be here, so we will have a quorum for that. So mark our calendars if for August 8th for our next regularly scheduled board meeting. Are there any other agenda items that the board would like to have staff prepare for that next meeting? Doesn't sound like it. I am anxious to see the next marketing report since we will be hot and heavy into the marketing at this point. So we look forward to it. It was a good presentation this meeting as well. Mr. Hager?
For the record, John Hager, one thing to add, we are scheduled to have an adoption hearing for a minor regulation that would be going into effect if the board approves it on August 8th. So that will be scheduled in conjunction with the board meeting. It has already been posted. In accordance with the policies set by the board, and there are 2 optional, 2 different wordings for the regs based on the conversation at the workshop, and the board could choose to adopt either one of those.
Okay. Thank you for bringing that to our attention. Again, I knew we'd had it posted. I forgot that it was scheduled that day. Any other comments regarding agendas or future meetings? All right, that takes us to public comment. Do we have any public comment in North Las Vegas?
No, we don't.
Thank you. How about here in Carson City? How about on the telephone? Doesn't sound like it. All right, sounds like we have no public comment for this last agenda item. I want to thank everyone again for their attendance and preparation, and thank you, staff, for always putting it together so nicely and making it easy for us to get through all the materials. So with that, we'll adjourn the meeting, and we'll see everyone in August.